Judy Klein, president of Unity Consortium, and delighted to welcome you to today's Adolescent Immunization Action Week dialogue, Staying on Task, New Trends in Vaccination for Adolescents. Adolescent Immunization Action Week is all about helping our young people stay healthy by keeping up to date on immunizations. We found that parents and teens prioritize many day-to-day healthy behaviors for teens, but recently vaccination has fallen in importance significantly. We know this from parents and teens that Unity regularly surveys about adolescent health and vaccination topics. One reason for this change may be due to the increase in vaccine misinformation in recent years. 3 out of the parents and teens surveyed felt that there is a lot of misinformation about vaccines and that factual information is both difficult to find and difficult to understand. They rank social media among the least trusted sources of information, with healthcare providers being the most trusted. There were big differences in trust depending on where families live. People living in rural areas, for example, are significantly less trusting of most information sources compared to their suburban or urban counterparts. And though social media is least trusted, it has succeeded in raising significant concerns about vaccine safety and effectiveness. Now let's turn to trusted people to hear their thoughts on the importance of vaccines for adolescents and young adults. Please do ask your questions or share your comments in the Q&A section. It's my pleasure to introduce today's participants and our moderator. Admiral Rachel Levine is the Assistant Secretary for Health for the U.S. Department of Health and Human Services and the head of the Public Health Service Commission Corps. Admiral Levine's storied career, first as a physician in academic medicine, focused on the intersection between mental and physical health, treating children, adolescents, and young adults. Then as Pennsylvania's Physician General and later as Pennsylvania's Secretary of Health, she addressed COVID-19, the opioid crisis, behavioral health, and other public health challenges. Dr. Todd Wolynn is a co-founder of Kids Plus Pediatrics in Pittsburgh and Shots Heard Round the World, a vaccination advocacy nonprofit. He's worked with vaccines for more than 25 years in roles including immunizing pediatrician, clinical vaccine researcher, vaccination communication and disinformation researcher, and vaccination advocate. Jen Sanderson is a parent, educator, and Unity advisor living in Wisconsin with her 6 wonderful children, ages 14, 12, 11, 9-year-old twins, and a 6-year-old. She's a teacher and has been a vocal and insightful participant in Unity's Mom Advisory Council. Our moderator, Dr. Chelsea Clinton, is a longtime Unity partner. As vice chair of the Clinton Foundation, Dr. Clinton works alongside the foundation's leadership and partners to help create economic opportunity, improve public health, and inspire civic engagement and service across the U.S. and around the world. In particular, Chelsea focuses on promoting early brain and language development through the Too Small to Fail initiative and uplifting and empowering female entrepreneurs and women-led businesses around the world. Dr. Clinton.
Well, Judy, thank you so much. And I just, again, want to say, how proud we are at the Clinton Foundation to partner with Unity and to support your truly vital work in helping ensure that there is good information reaching children, adolescents, parents, and really everyone around the country as it relates to vaccines and vaccinations, and to say just how honored I am to be sharing this virtual space with the panel participants and particularly Admiral Levine. Admiral Levine, just listening to all that Judy shared, the challenges that unfortunately have only grown in the last few years as relates to kind of adolescents' concerns around vaccines and vaccinations. Curious from, I think, as Judy aptly said, your storied career, how you think about rebuilding trust, particularly with adolescents and their families when it comes to vaccines and vaccinations, and how to help kids and parents alike really know kind of what good information looks like, and what not so good information looks like, whether it's coming from a healthcare provider, a public health professional, or as Todd and I were talking about before, TikTok.
Well, thank you very much. It's a pleasure to join you today and to kick off this webinar about new trends in adolescent vaccinations and to call attention to the importance of vaccinations during Adolescent Immunization Action Week. The immunizations are very important to me. As you know, I'm a pediatrician and adolescent medicine specialist, so a lot of my work has focused on this. And immunizations are one of the victories of public health in the 20th and 21st centuries. We are able to prevent serious infections. We've eradicated smallpox. We've been able to control the spread of polio, which was very serious outbreaks previous to vaccinations. And vaccinations given during adolescence are so important. The human papillomavirus vaccine, HPV, the meningococcal meningitis vaccine, and more. But you're right, we have to continue to work against the misinformation and sometimes the overt disinformation that we see. And I think that we need to highlight the trusted messengers that we've been talking about, and really particularly families, their doctors, their pediatricians, their family physicians, who are the best trained to be able to give advice to those families, those parents, and their young people. As we've been talking about, social media is not the best place to get information about these issues, but there are good websites that people can go to. There's hhs.gov, and there's immunization information about vaccines, the CDC website, and for me as a pediatrician, the American Academy of Pediatrics website.
Admiral Levine, just because you mentioned the HPV vaccine, and this is an arena and a kind of specific area of focus for Unity, as it kind of engages with its adolescent members and its adolescent ambassadors, equipping them with, the real evidence and data to help talk to their friends around kind of the importance of getting the HPV vaccine. We know some countries are on track to eliminate effectively cervical cancer because of such robust kind of population, level HPV vaccine efforts now over the last couple decades. What can we be doing to try to also have that goal of elimination in sight here in the United States? And what advice would you have, for the young people who are on this webinar now or who will be watching it later as they think about kind of making that decision for themselves, but also then talking to their friends about why it's important that they go and get their HPV vaccine?
So you're exactly correct. The HPV vaccine is such an advance, and I actually remember it very well because I was in academic medicine when it came out, and we were so excited about the ability to prevent infections with human papillomavirus and prevent cervical cancer, prevent penile cancer, and many types of laryngeal cancer. It had gotten somewhat of with misinformation that it was a quote unquote sex vaccine, and it's a cancer prevention vaccine. That's exactly what it is. And other countries haven't had that type of misinformation and are eradicating, as you said, those types of cancer. So I think that we need to do a better job and continue to work towards giving the factual information about this. It is a safe vaccine, it is an effective vaccine, and it's a cancer prevention vaccine. There is absolutely no data to support that it really has anything to do in terms of when teenagers start to be sexually exploring and sexually active, and it really needs to be given to prevent these types of cancers. So, we all need to, in medicine, in pediatrics, family medicine, but also with fantastic advocates such as yourself and Unity, to get the message out about how we can prevent cancer.
Admiral Levine, mindful that we, I think, have you for another 10 minutes, want to just continue to draw on your expertise and your kind of current position, atop our public health infrastructure. And also want to encourage folks who are in the webinar to ask whatever questions they may have for you over the next 10 minutes. And we've just received the first one from Carla, who asks, why has the HPV vaccine not been included as a mandatory vaccine in order for children to attend school? We have some mandatory ones, and with all the research you just cited, why is HPV not one of those? You wonder if you could answer that.
Thank you. It's an important question. The HPV vaccine, as I said, is safe and effective and is a cancer prevention vaccine. But, as it was coming out, there was misinformation about because HPV associated with cervical cancer, penile cancer is associated with sexual activity, that somehow it was a quote unquote sex vaccine, that there was somehow going to encourage young people to have sex. And so it's become political. And unfortunately, this is yet another public health issue which has been politicized. And so as I was the Secretary of Health of Pennsylvania, we discussed the possibility of trying to make it one of the required vaccines for school. And politically, we could not accomplish that in a bipartisan way. But I think hopefully as we can get past the politicalization of public health, we can include the HPV vaccine in those required vaccines for school where it should be.
Admiral Levine, I wonder, if you could also share kind of how you would encourage, adolescents who often do have now, one-on-one time with their pediatricians to think about being comfortable asking what questions they have, because I don't think we ever want to be in place in telling kids, no, you can't ask any questions. We also just want kids to know what's good information, what's not good information. And yet part of ensuring that, children and adolescents are able to build kind of cumulative, like trusting relationships with their pediatricians and with kind of healthcare more broadly is feeling comfortable asking questions. How would you help, again, any of the adolescents who are on this webinar have kind of the comfort and the confidence, to talk to their pediatricians about kind of the HPV vaccine and why it's so important, and feel comfortable asking questions based on good information and hopefully not bad information?
Well, you're exactly right. A young person's pediatrician or family physician, perhaps an adolescent medicine specialist, really should be trusted adults for young people, and they should have the opportunity to speak with that medical provider alone. And it is a responsibility really of the medical provider to assure confidentiality to the young person with few exceptions, and to be able to open things up for the young person to be able to talk freely. That also might be a nurse practitioner or a physician assistant. But it is very important for that relationship to develop in early adolescence and then to continue to grow as the young person grows. And then they can feel comfortable talking about these type of issues, about the HPV vaccine, about sex, about other issues that they might be having at school or in their personal lives. And it's important that parents trust their medical provider to be able to provide that confidential care. It's a relationship that needs to grow, and it is really incumbent upon the medical provider to kind of initiate that. And in academic medicine, I spend a lot of time doing that, teaching pediatricians and family physicians and others how to initiate those conversations and make the young person comfortable.
Dr. Levine, I wonder if we could also just shift now to kind of talking about the flu vaccine, where, sometimes I hear young people say like, well, nobody I know ever gets really sick, right? Isn't that just for like babies and old people? Like, how can you also help adolescents who are here, with us today, who clearly, because they're choosing to spend time with us or they're going to watch us later, care about, vaccines and kind of vaccination broadly, think about how to make the case to their friends about why it's so important to get vaccines that they may not feel are relevant to them, but are relevant to their family members and their community, and also are relevant to them. Maybe not in as immediate a sense of, wow, you can avoid getting cervical cancer or penile cancer, but you don't want the flu either.
You don't want the flu. Influenza can be a very uncomfortable condition, almost at best, and potentially a serious condition, even for young people. So it is important for young people to get their annual flu shot to be protected from the flu. But by protecting themselves from the flu, then they're also protecting their family and their friends from contracting the flu. So they might have grandparents or parents who might have other medical conditions, or their grandparents who might be seniors like me, and others who might get be more susceptible to the flu, maybe their younger sibling, maybe their grandparent. And so by protecting themselves, by getting that annual flu shot, they're protecting their family and their friends and really their community from the spread of the flu, which again, in some people can be very, very serious. For themselves, the flu, it could be serious, but it's certainly going to be very uncomfortable, and they'll be sick for a number of days. So they can prevent that for the most part with a safe and effective flu shot. So it's an important issue in the fall. It's also an important issue in regards to the COVID-19 vaccine. So we'll see what the official recommendations are from the FDA and the CDC, but I think we can anticipate the recommendation for a annual COVID-19 vaccination at the same time, and they can be given together.
I wonder, Admiral Levine, in the last few minutes, if you also could reflect on what Judy shared has been, what they've seen from a Unity perspective, kind of over time in different surveys, which is kind of the particular erosion of trust among people who live in more rural communities. And kind of what advice would you have for adolescents who are joining us here today, or those of us who are no longer adolescents who kind of live in rural communities, have loved ones who live in rural communities, you may be practicing, medicine, doctors, nurse practitioners, school nurses in more rural communities. Just kind of what reflections or advice kind of would you have for people who are kind of living in communities where there's been a particular breakdown in trust, who very much, are committed to understanding kind of how to repair that trust and then truly kind of rebuilding that trust, particularly as it relates to vaccines and vaccinations?
Well, thank you for that question as well. These infectious illnesses don't know any boundaries. And so they can be seen in every state in the United States. And it can be in urban areas, suburban areas, but very much in rural areas as well. And of course, around the world globally. And so it's very important for people living in rural areas to have that trusted relationship with a medical provider. Sometimes that might be virtual visits, but in-person visits as well. And to have that trusted relationship for their family with a pediatrician or family physician, might be a nurse practitioner as well, and to trust their voice about these vaccines, and to protect themselves and their family and their communities in rural areas as well from polio, from the measles, from HPV, from meningitis, from all of these different illnesses that our childhood and adult vaccinations, as well as our yearly respiratory virus vaccinations can do.
I was thinking, Admiral Levine, because you just mentioned polio, I remember, and I may have had the chance to talk about this before, but I remember my grandmother talking about when the polio vaccine was finally approved and how like that feeling of just increased safety and opportunity and possibility for her children. And, that she took, my mom and her younger brother, and they stood in line for, I think, like 6 hours in Chicago to get the polio vaccine, and how it just truly felt transformative to her that her children could go to the pool in the summer and she wasn't going to be so concerned. And that hopefully, they wouldn't have this kind of just dark, oppressive cloud of worry, in their lives that she had always had for them. And I just, every time someone talks about the polio vaccine, I remember my grandmother, sharing these still quite emotional reflections, decades later.
And I heard those same stories from I heard those same stories from my parents about how worried they were about myself and my sister, and they were just absolutely thrilled that we would be able to have a vaccine that could prevent what they saw in the 50s or maybe early 60s with the summer spread of polio, and children that would be severely afflicted and could have potentially even lifelong disabilities from polio. But even a more recent vaccine, I remember in my training in the 80s and then in the 90s, a bacteria called Haemophilus influenza type B, or Hib, that would cause, we saw at the hospital at Mount Sinai in New York City, severely impacted children with pneumonia, with meningitis, with sepsis, with bone infections, very severely impacted children. And with this vaccine that is given not during adolescence, but during childhood, pediatricians never see that anymore. They never see severe invasive Hib infections. And that's in the last 30 or 40 years. So we continue to see the benefits of childhood, adolescent, and adult vaccinations in terms of our public health. And it really is important for all of us to work together to dispel myths, to address the misinformation and overt disinformation that is prevalent. So children and adolescents and adults and all their families can have these potentially life-saving vaccinations to protect the public health of our nation.
Amen, Admiral. Thank you so much for being with us and for your time and for your just fierce commitment to the health and well-being of our country, and particularly, as a parent, to the health and well-being of our children. I'm incredibly proud to have you kind of atop our public health architecture, and we know your time is always called upon. So we're grateful that you were with us here today at the Unity webinar.
Well, thank you very much for the opportunity. It's wonderful to see you again. And everyone, please take care.
Thank you so much, Admiral. I wonder, Jen and Dr. Wolynn, if we can now turn to the two of you. I think, the Admiral kind of gave us a perfect segue, when she was saying, we need everyone. And so we certainly do need, our doctors, our advocates, our parents. And I wonder if we can really start actually with kind of the parent component. Jen, if you could share kind of why this is so important to you, as a parent, also as an educator, and kind of in what you've seen to really work in your conversations with other parents to help increase awareness of all that kind of, the Admiral was just talking about as to kind of what vaccines have done for public health and personal health over the last decades, and why they're actually still so important to continue. It's not like we can check a box and look at them in the rearview mirror.
Right. Well, I know for me, it started actually when my eldest was born. He was born with a pneumothorax. So he spent the first 3 months of his life on oxygen. So we kind of decided fairly early on, because he had such a rough start, that immunizations were very important. And then in addition to that too, I've got some family members, some friends who are also have some autoimmune things. They may be immunocompromised. So we want to protect ourselves, but also our family and friends, so we can be around them. I have 6 kids. So as you can imagine, whenever a bug comes into our house, it hits us and it can stick around for a little while. So whatever I can do to avoid that as well. And as a mom, I don't like to see my kids suffer. I don't want to see them sick, at all. We were some of the first people to go get the COVID vaccine as soon as it was released for kids. We went straight to our health department before our pediatrician even had it, just because I wanted them to get that protection, so we could have a little, ease my mind a little bit, make them feel more comfortable with what's going on. And then as an educator right now, especially, I work with middle schoolers a lot. And at this age, I feel like everybody thinks they're invulnerable and nothing's ever going to happen. They're never going to get sick. So I really feel like this age, it's super important to start, teaching them more about why it's important for your immunizations, what happens when it gets sick, why things spread so fast, because they don't know any better. They're still kids, they're still young, and they're still learning. So I hope that helps answer the question.
No, definitely. I mean, I'm nodding so much partly because yes, we do the same in our house. We talk to our kids about why it's so important that they're getting their shots. Similar to you, when the COVID vaccines were first approved for kids, we also went to kind of the immunization clinics, like here in New York City, the city rolled out before kind of vaccines had reached kind of pediatricians' offices, and we're incredibly grateful and excited and just full of awe that this was something that we could do for our family. I wonder, from your perspective, Dr. Wolynn, as both a doctor and also, an advocate, kind of a similar question of kind of what are the conversations that you have found to really be effective for parents, and also since Jen talked about being a middle school educator too, like what have you found to be really effective with adolescents or even younger kids?
Yeah, thank you. The year upon year, when we look at data on most trusted professions, it's typically nurses, not far behind, followed by doctors. But if you break it out by specialty, pediatricians are right up there. And when I talk to pediatricians and family docs nationally, I think we squander the opportunity to have these heart-to-heart talks with families and most importantly to listen, right? There's so much disinformation, as the Admiral said, floating about right now that people aren't sure what's right or wrong. And don't forget, when we see families in the office, we're not just immunizers, right? We talk about car seats and we talk about sunscreen and we talk about colds and a variety of things. So by the time, particularly for adolescents, I've been taking care of kids for over a decade. And oftentimes if they have siblings, sometimes for much longer than that. And so this inherent trust is a wonderful foundation to build these conversations to address any of the vaccines we've talked about so far. And to, again, I need to point out, given the amount of disinformation that we are facing right now, clinicians are not necessarily the best communicators. We have trust, but when disinformation is thrown in there, we have to use our listening to understand what is concerning to families.
And I actually think that's a good prompt to then ask, how should we be better equipping our healthcare providers? And I kind of mean the we in the broadest possible sense, right? Like whether medical schools or residence training programs or public health, departments, or, everything that kind of Admiral Levine and HHS might be able to do, but also parents. How can parents best support? Like how do we try to help pediatricians and family medicine doctors and nurse practitioners and kind of everyone that we know really does still have this enormously valuable, vital kind of resource of trust with parents and families, including kids. How can we better help them kind of be the communicators that we know they want to be, and that bluntly, like we as parents and the public need them to be?
Wow. Could I thank you for that question? So the key here is that, again, we're not trained in communication. Believe it or not, we're trained in microbiology and we're trained in immunology and we're trained in anatomy. We're literally not trained in communication. And right now we're up against this. I had a tweet out in like 2017 after we were kind of victimized by the anti-vaccine industry saying, I was taught to fight and combat viruses and bacteria malignancies, when who knew I would be fighting things like conspiracy and politicized science and all these wacky things and insurance stuff. I mean, we aren't trained for that. We need to be. And so my call to action when I speak around the country nationally, it is literally just what you said. It is going all the way back to the training programs and all healthcare professionals, not just physicians. I'm talking about nursing schools, pharmacy schools, PT schools, because we all have credibility with our families and our patients, right? We serve people in their most vulnerable times, but we aren't taught how to communicate. And so I've used a variety of different methodologies to teach families or to teach providers, healthcare providers, literally active listening, mirroring back people's words so that they know, what they're thinking. They may, there's this fact that you don't want to amplify a myth. But by repeating the words to make sure I understand what it is that's scaring you, I can actually not only display active listening, but I can show some freaking empathy. And I can say, that would scare the hell out of me if I thought that was true. Can I tell you why I got my daughter or my boys vaccinated for HPV or COVID or flu, right? I think that it sounds like it shouldn't be so sophisticated, but we're taught all this minutia, but we're really not taught some of the best practices in listening and discussing things, and also trying to understand the other person's point of view. There's nothing wrong with asking questions. I don't think we should ever categorize somebody as hesitant or anti-vaccine because they have questions. We should be able to ask, they should be able to ask those questions in good faith, and we should be able to have that conversation. But there are times where, particularly on social media, questions aren't always in good faith. But in the exam room, this person's been bringing their most prized thing in their life, their child, and putting them in your hands. So that's a wonderful foundation to build a discussion upon.
And Todd, I think that's such an important point of you have to engage differently, as I know you very much do, with the kind of bad faith actors generally kind of online, although I know kind of the bad faith actors have also shown up at pediatricians' offices or outside public health kind of professionals' homes. So I'm in no way saying it's only kind of in online spaces, but that requires a different set of tools, I think, to communicate and to be very clear about what is true and not true, and to acknowledge when things are not being kind of engaged kind of with and in from a place of good faith is very different than kind of how you engage with understandably worried parents, because we all are in some way worried parents about our kids and have different questions.
Yeah.
I wonder, Jen, kind of turning back to you, and then we also are getting a lot of questions on the Q&A that I will kind of turn to in a moment. But given you spoke, so clearly about kind of why, it was the right answer for you, given the health of your family and the health of friends and family members, to ensure kind of everyone's up to date with their immunizations. How do you kind of have conversations with friends or with other parents in your community who, want to do the right thing, but do have lots of questions and maybe have kind of understandably been kind of confused about all the information that exists and have a hard time distinguishing, as Todd was saying, between the misinformation, the purposeful disinformation, and the good information?
So I try to start by listening and being empathetic first. Everyone has their reason for why they do or don't do something. Generally, when it comes to like some of the more like controversial type vaccines, it may just kind of come up like, oh, I would never do that. I will chime in with, well, we did it because this is why for this child, or this is why for my family. I kind of keep it real personal. And then I just kind of listen, like, why, and I kind of question, kind of turn it back on them, to find out what their real reasons are. Is it medical? Is it something that maybe like they're just scared, but not wanting to say they're scared for it. And I just try to keep the discussion like just open, and not me going, well, you really should do that because this is the best for everyone, but really trying to understand their side. I feel like when it comes to some vaccines, HPV, I know, has been one because everyone's kind of like, well, I can't do that at this age. I need to wait. I get that. And again, I just try to listen. And I feel like if we can be a little more open to listening to each other before we jump and judge, we can hear each other better,
I think, yes, we all always can work on having kind of open ears and open hearts, as I say to my kids. And it's an ongoing, I think, journey for all of us, I hope, at least. We have now a number of questions, also quite a bit of feedback, a real appreciation for the importance of listening, of the importance of time, and, Todd ensuring that we're doing a better job of, yes, training our healthcare providers, but also compensating them for the time to have these conversations. And so just want to acknowledge kind of some of the feedback in the Q&A, even though it may not be specific questions. I think kind of important that those kind of voices and thoughts kind of be more broadly acknowledged. But I do want to turn to some of the specific questions. So, one, how can health educators help parents and healthcare providers bridge some of the gaps around vaccine education and information distribution? So maybe think about, community healthcare workers or school nurses, kind of other people, or people who teach health in schools, Jen, like in your school. Wonder if both of you might offer kind of some thoughts in response to Brandy's question there.
I'm happy to take a first stab if you want, Jen.
Yeah, please.
So I think an important role, one of the multiple important roles, and again, in this day and age, it's kind of odd because I find healthcare providers and teachers are both under attack right now because of the whole environment that we're in. But I think one of the really important roles that educators can play is media literacy. How do we decide what's real and what's not? How do we check facts? How many sources are we using, right? Those are really important tools for kids, given that now in this day and age, they're growing up with this. This is every kid right now in school and beyond. There will never be a time in their life with this device not being attached and literally curating most of the content that they get. So how do they help curate that content? How do they determine what's right? And I would say teachers and families, that relationship with educators, they're seeing their kid for sometimes more waking hours than the parents themselves. So it's an immensely important position and opportunity.
Jen?
So I guess starting as a parent first, you really have to keep the lines of communication open with your kids. These middle school years especially are so tough. They don't want to talk to you. They don't like you. I mean, I've got to I've got a 12-year-old. I got a 13-year-old. I've got soon to be soon to be 11-year-old. We're going through all the phases right now. Some days we like me, some days we don't. Just every day, set a time to discuss. And I do try to set a time each week actually to talk about health specifically, because I want them to know what to expect as they are going through all of these fun changes right now. And then from the educator standpoint, again, just like what Todd said, when it comes to like misinformation, like we are really trying to push, I know in my classroom, like look at your sources, don't just Google something and take the very first thing you see as the answer, keep going. I'm actually very lucky where my room is located in my school. The cell phones don't usually work that often. So it's great motivation for those to stay in backpacks. But yeah, that's what we kind of do with sources and, talking with kids in my family.
Yes to all of the above. I feel like whenever my kids say like, can I tell you something? I would say, yes, you can tell me anything. Right? Or can I ask you something? Yes, you can ask me anything. And it's often like, can I have applesauce before dinner? I'm like, no, you can't have applesauce before dinner. But I hope if they know they can ask me anything, even if they don't get the answer they want for the small things, it creates kind of the habits and the tradition and the relationship to ask kind of the bigger questions, whether they're about vaccines or anything else.
It's because Big Applesauce has already reached your child. I'm sorry.
There you go. There you go. Yes, absolutely. Someone just mentioned social workers, community health workers are also instrumental in kind of these conversations on vaccine and vaccinations. Absolutely. Todd, I think we have a couple questions that are really kind of for you, although of course, Jen, please chime in. One really around kind of access in more rural areas to vaccine and vaccinations where they just may be harder to find. And then another question around why there aren't kind of standalone HPV vaccine clinics.
Yeah, I mean, some of this is driven by our very fractured healthcare system, and so access is problematic. I will say the backbone of vaccine delivery in our country is from primary care providers, though there are public health clinics and sometimes vaccination clinics. In other countries, that's not necessarily the way the vaccines are delivered, but in ours, it is through your primary care provider. So I would say having a primary care provider, which could also be with a federally qualified health center. There are a variety of different places that are built specifically to serve underserved areas, whether rural or urban, but that don't have a huge amount of providers. Let me see. I'm trying to make sure I get that. So yeah, access is a very real issue. And sadly, in rural areas, again, because of our very fractured health system, where systems can't necessarily see an easy way to generate a profit in various areas, we do see diminished access and resources. So that is something that from a policy level, I think we have to press upon our legislators. That's the same thing with Wi-Fi access in rural areas and other areas and other resources that are necessary. So that's something I think we have to tackle with policy as well as a practice. But I would reiterate, please make sure you get a primary care provider. And I will say, if in some areas there's not a wide range and you have somebody that isn't necessarily up to date, that can be challenging too. I was a board certified lactation consultant for 25 years, and sometimes the only provider in that area wasn't necessarily knowledgeable or supportive, and you're left in a bit of a desert, like you don't have somewhere else to go. So hopefully your provider is up to date with their vaccine knowledge as well.
And someone, Linda also put in the chat, the importance to remember pharmacies and pharmacists for education and access, which I resonate with, because certainly I do have a great primary care doctor, but I generally get my flu vaccines and my COVID vaccines at the pharmacy down the street. So I resonate not only from a public health perspective, but also a personal one. Going back to some of the questions, we have a question from Riley, really for both of you. If you could tell parents one thing about adolescent vaccinations, what would it be? Maybe you could pick two, but like one or two.
All right, I'll answer this, from a parent. I'm not gonna lie, when my oldest was approaching that age, especially my second oldest, because she's my oldest daughter, I was a little nervous just because I had heard, a lot of the negative comments from different family members and friends and things like that. And instead of, solely relying on like one person's opinion, I did make sure when I went into her, I think it was her 10-year well child visit, like, hey, can we please talk about this? Can we set aside time during this appointment to really talk about this vaccine? I have questions and concerns, and I guess I'm just not sure what this is doing and why is it important. So that kind of helped me, like having my child's like pediatrician just kind of sit down and take a moment to be like, oh yeah, we can absolutely talk about this. Cause the way she was kind of acting in the appointment, it made it seem like I should have already known this information. So I was a little, like nervous, like, hey, slow down. I don't get this.
Yeah. Todd, any?
Yeah. Again, building upon that relationship is having this discussion. There's 3 vaccines that tend to, well, now 4 that come under attack a lot, right? The MMR used to come under attack a lot, influenza, the flu vaccine, but HPV for sure, and now COVID. And so for adolescents, it's to get your questions answered. I will tell you that we start talking about the HPV vaccine, one which has obviously been targeted, as we said, oftentimes by anti-vaccine industry. But we let them know at 9 why it's such an important vaccine to get. For instance, people, the disinformation that goes around, there's like, well, I'm not sure if my kid's ready. And I said, well, did you have any problem getting the hepatitis B vaccine? That's the one we give as an infant. And the answer is no, we just got that vaccine. And my follow-up to that is the main way we get hepatitis B now is through intimate contact. That is the main way. And so it's the same way you get HPV. But we don't seem to have this long drawn out conversation. We say hepatitis B vaccine is really important. It can cause, the virus can cause lots of bad disease, including cancer. But here's a vaccine, the HPV vaccine, human papillomavirus, that is an immensely successful and safe vaccine at preventing a huge amount of precancers and cancers. Here's the deal. Like, if you're intimately active, you're almost for certain going to get HPV, like 80+%. And the great news is that 90% of people will clear that virus on their own, but 10% won't. And the 10% that won't will go on to get precancers and cancers and fatalities related to those viruses. And I used to say, watching a kid walk out of my office without, getting the vaccine is literally like, that might be their last best chance to have been protected. And the fact that we have something in our arsenal to protect from such a terrible virus. And right now, like, head and neck surgeons are the most passionate advocates about this, this vaccine, because they said it's the worst surgery they have to perform. And so I'm just very passionate about these types of vaccines. And I, again, having the discussion and asking the questions if you have them.
I think, Todd, that's a good segue. Teresa had a quite long, I think, important question, and I hope they'll have forbearance for me summarizing it a bit. Acknowledging that many people have vaccine fatigue. That we've had so many conversations. There's been so much kind of public education. There's been so much unfortunate kind of mis and disinformation, and kind of really just questioning what is the right balance between kind of those conversations, Todd, like you're able to have one-on-one as a physician, or Jen, that you're able to have as a kind of parent or parent educator to your fellow kind of moms, how do you balance thinking about that versus the broad public campaigns that do remind us every season that it's like, flu season, get your flu vaccine? How do you think about that right balance? So you're not hopefully kind of adding to fatigue, but you are reminding people while also having space for the conversations that we know are more likely to really kind of build trust and lead to someone, hopefully, right, a vaccine that, they need to help protect their health and to help protect our shared public health.
Well, I'll go back to part of the training on conversations. When clinicians are asked questions about vaccines, if they're uncomfortable with like, oh, this person seems like maybe they're not sure if they want it, because we're not trained, the two things that healthcare providers tend to do is go right to evidence. Let me tell you about the 95% confidence intervals around this study. That's not the place you need to be. Or they talk about scary stuff. Let me tell you about how many people die, right? And let me show you scary pictures. When in fact, what needs to be done at that point is listen, understand, mirror back words. But you can also make it personal, right? Almost every mom knows, you know why you go for your pap smear, right? You go for your pap smear to detect that you've already been infected with this virus, but that we can at least destroy the tissue it's contained in quickly enough before it spreads. But imagine in a continent and a country like Australia, where there's a mandated vaccine, where they're now predicting the end of cervical cancer within a generation, right? We have states in the United States, Rhode Island and Virginia and Puerto Rico now do have a mandate for this vaccine going into school, but most don't. But like, who's pro-cancer? But the problem is, again, the disinformation's been thrown around there. So back to your point, Chelsea, is you don't want to proselytize, but you want to be able to give real examples like a pap smear, which people can relate to. Yeah, I don't really like getting that, but I know I have to. But imagine where you can talk about a future where the elimination of something like that is possible if we get our vaccination numbers up.
Yes, I think that's such good advice from both of you. Another question from Amy. In the state of Ohio, parents can exempt out of required school vaccines by reason of conscience. We've seen higher rates of reason of conscience exemptions in the schools, particularly in parochial schools. Any suggestions to kind of address this challenge with both schools and parents alike? And maybe Jen, we can start with you, and then Todd, turn to you.
So this actually makes me kind of nervous that more and more places are kind of allowing for that opt out. Number one, as a parent, because again, I have so many kids, I don't want these bugs coming into my home. And number two, as an educator, like it or not, I mean, whatever bugs are going through the schools, us teachers are kind of there, and we're going to get hit. And it's not like we can just go home and recuperate and rest. Oftentimes we are so short staffed that we're kind of stuck here unless we really just can't get up. And that makes it very hard. I feel like these opt-out things, is just putting too many people at risk. So what I kind of do every year as a parent, and getting together with my girlfriends, we kind of talk about, this is what I heard is going around school this year. Oh, hey, did you get your flu shot? I mean, it's a great time to be like, oh, did you schedule that appointment yet? As we are talking about these things. So, I'm mentioning it. I got a couple of friends that work in healthcare who are like, oh yeah, we can start doing ours next week. So it kind of is a great way to get some of our friends reminded, oh yeah, hey, I need to go do that now. And maybe hopefully get some others who weren't thinking about it to start thinking about it. Just because it's not fair to put other people at risk when we don't know their health situations.
Todd?
Yeah, this is somewhat of a scary time, right? As Dr. Palafa likes to say, vaccines are a victim of their own success. And because we don't see polio around, we think, oh, we don't need to get polio vaccines. And, that was the same thing with measles. How bad can it be? Well, we're seeing the reemergence of measles, which was considered eliminated in the United States in the year 2000. During the early years of COVID, we saw polio virus being detected in the United States. As he likes to say, Dr. Offit, where we're always a plane ride away from pretty nasty diseases, that we've been able to keep at bay and really diminish the really horrible outcomes because of the concept of a community immunity or a herd immunity. And when that drops, we are now seeing the emergence again of reemergence of diseases like measles. So what's the best way to go about that? Well, sadly, I will say because of the politicization of healthcare and science in every state, there are at least active attempts at legislation to reduce or eliminate the mandates for vaccines to attend school. And they're right. There are different loopholes that people get around this. The problem is, as you start dropping the percentage of kids who are typically vectors, meaning they spread it to other people, we do see this emergence of lots of diseases, particularly ones that are driven by respiratory. But look at something like right now, like norovirus, that's out everywhere when you don't yet have a vaccine for norovirus. But look how easily it tears through the country because it's spread easily. And so I would say that we need to remain educated and active in our local and regional and even national debate and discussion about the importance, like who's on your school board, what's going on in your locality or your municipality is in some ways just as important as what's going on at the state and national level. So stay active and stay informed and, discuss these things with your trusted health care professional.
All such important kind of advice and suggestions, Jen. I think of how you kind of organically bring up these conversations and Todd, what to be mindful of. Just to be respectful of everyone who kind of put things in the chat. We had someone talk about how critical motivational interviewing could be, particularly as it relates to HPV conversations and kind of highlighting evidence-based approaches. Appreciate the mention of federally qualified health centers, but also don't forget about school-based health centers. Completely agree with that. And the need to be respectful of both parents and children and kind of asking questions about kind of what parents and kids maybe have heard about vaccines, and then kind of using that to hopefully ask for permission to share kind of what we may know about vaccines, and that just all of these conversations need kind of time and grace and persistence. And of course, always the evidence and the data. I know we're kind of running up on time. I just want to, before we kind of hand it back to Judy, acknowledge that this is Adolescent Immunization Week, that Unity, I think appropriately, is kind of urging all of us to stay on task, to trust good resources, ask questions, schedule an appointment, and know where to get vaccinated and for what kind of we all kind of should be vaccinated and when. So just really kind of want to thank, I know kind of the Admiral had to leave, but kind of thank Admiral Levine again for being with us and for her stalwart leadership, and to thank Jen and Todd for being with us as well and their leadership, because as I think kind of the Admiral said, we need everyone to continue to help protect the health of our children, our adolescents, but also kind of our community health. And so just incredibly proud to be kind of in this work with Unity and all of you. And Judy, I want to hand it back to you.
Thank you so much, Dr. Clinton, for your continued support. And of course, I appreciate you thanking everybody else, Dr. Wolynn, Admiral Levine, Jen, for your candid conversation, ongoing support with the parents in your network. As we have heard, vaccination is critical for staying healthy. And, we talked a lot about misinformation and purposeful disinformation. And Dr. Clinton, thank you for mentioning the things we can all do to stay on task and support parents and teens to get the credible information to make the decisions that are right for them. Please do go to unityforteenvax.org for more information about Adolescent Immunization Action Week. Tomorrow we have our young adults in a panel discussion, which you can find on Unity's YouTube channel. We have a new Vaccinated episode coming out, and the National Council on Negro Women's Good Health Wins is hosting a national town hall on Thursday evening, which you can sign up for. Please do complete our brief survey as you log off to tell us what you thought of today's webinar, as well as to put in suggestions for